Welcome to Reality Check. I'm Dave Nicholson, and this is a program where we dig into subjects related to the deployment of information technologies. Yes, AI, which is all of the rage this decade. We talk about how real people are making real decisions about how to deploy these things and what the ramifications are. Often we're talking to business leaders, and often those business leaders are making decisions with real money and real reputation points on the line about how to deploy these things. This conversation is frankly going to be more interesting and more impactful because we're not talking about maximizing for profit necessarily. We're talking about maximizing for outcomes, specifically human outcomes in the field of medicine. And I am very, very delighted to have Dr. Julien Sanon. Julien Sanon. Dr. Sanon, thanks for being here with us.
Thank you, Dave. Thanks for that invitation. It's a real pleasure to be here.
Yeah, so we're going to talk about, sort of the intersection of AI and medicine. And Dr. Sanon has done a fair amount of study of this subject, and he lives his life at the front line of medicine. Julian, can you share with us a little bit of your background in terms of the specialties that you're involved with?
Well, I am a internist. Basically, I work mostly as a hospitalist and as a nephrologist. I'm training both of them. So if I'm not working as a nephrologist, I'm working as an internist. I have a license in nutrition, a master in public health nutrition. I am involved a lot in cardiovascular-kidney-metabolic syndrome. This is a new field in medicine. It's basically not new, but the American Heart Association came out with that uh, guideline, that framework, in a sense that most of our patients that we have who have heart disease, kidney disease, and metabolic disease will end up having um, cardiovascular disease from heart attack, stroke, peripheral artery disease, heart failure. And I have been involved also in digital technology, mostly AI. So I've had some training over in healthcare transformation with Harvard in terms of how do we use technology, how do we use AI, and so I'm very much involved in that. And as you know, I met you and I learned a lot from you, extending my realm outside of medicine to go into business and see exactly how the business sector, how we can use what we can use better yet from the business sector and medicine. So that's how I got here.
Yeah, very interesting. So fair to say that what you describe is, yes, I'm sure you're dealing with acute disease, but often this is a long-term chronic situation that people are dealing with. I have personally had the joy of experiencing kidney stones. Joy, obviously, is not the right way to describe it, but 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 all of the things that we can do from moving our bodies to proper diet, proper sleep, all of those things. It's a fascinating field, and I'm wondering just on that front, just to start, where do you see physicians being enhanced by using AI technology? What would you say the current state is for physicians actually using any kinds of AI tools in practice? What are you seeing right now?
Very enthusiastic, and I think from a year or 2 years ago, I've been involved in that field, more so AI and healthcare, about 2 years. It's a huge difference. I think it's about 80% of the physicians now into it, whereas before it wasn't the case. Everybody was reluctant and worried about that AI will come and take their job, and that there was so many different misconception about it. I can see that physicians, and when I say physicians, are also will also include outside of that nurse practitioners and physician assistant. We all basically part of the same group, so we are embracing it a little bit more. There's still reluctance. People are worried that first that it'll take their job first. The second thing is that it will not be accurate. So it is we are embracing it. I think it's and there's the idea also that will it come and replace us? That I think we've come to understand it's not going to replace us. It's going to augment our job. It's going to make our job better, and we can see that we've been seeing that. And other point also is that there are some pain point that you get exhausted, tired of using administrative work that should be done by other people, then it's being done. So you get AI being able to do that for you. So it's very exciting. It's a very exciting time in medicine. I've talked to quite a lot of my friends who are in the field. They are very excited about it. I've taught them, or at least like I've showed them what I've been using, and they've been very excited about it.
So once people get beyond the concern that it will be an impediment or seeking to replace them or not up to the task, inaccurate, especially when you're ultimately taking responsibility for the decisions that you make. And again, and I say physician, but yes, absolutely the entire team. I must say that one of the most meaningful moments for me during my little kidney stone adventure was the nurse that held my hand as I was put under general anesthesia. I will remember that as long as I live. I was asleep for the part that the real technician performed. So, so yes, it's an entire team. But once doctors and healthcare practitioners have gotten past the concerns, if we look into the future, is there a concern that maybe this will cause the diagnostic muscle to atrophy? Will people become over reliant on these tools in a way that lessens that sort of dulls their intuition that might be important? Any thoughts about that, or are we ways away from worrying about that?
We are worrying about it. We definitely have to worry about it. We have to look at the future and see exactly, even our trainees, people that we are training right now, who are in medical school and residency, how do they learn? I think we are making some progress. Some big um, hospital, big centers have been working on that. I know for a fact because I partly train at Mount Sinai in New York, and they have a program where the residents are already using that. So and the medical school, so it's basically available for everyone. I know at other places also what I've taught and basically course that I've learned from my Harvard course is that a lot of times now we've come to understand that we don't really have, in terms of knowledge, we don't really have that knowledge, that we don't really possess that. So we have the resident understand they're coming with information. So they have most of those big medical school and big hospital have arranged a way for people, as exactly the clinicians, everyone to be able to use it. So we're gonna be using it. It's not there that it's gonna replace us. It's not there that we cannot go back. We basically it's a whole different way of it's transforming medicine, and we have to adapt. Ultimately, people will have to upscale. There will be changes in their job, but it is here.
Do you think that it'll change the profile of what constitutes an effective practitioner or an effective physician in the future? And I'm asking this from the perspective that my roommate in college, who I would say is my best friend from college, he's an emergency room doctor, and he explained something to me that I thought was really interesting. This dynamic associated with alternative medicine, and I'm talking about truly fringe, let's say illegitimate things, but people will gravitate towards them. And what he explained to me was, look, if you pay $50 or $100 and you go in and someone holds your hand and looks into your eyes for an hour and really gets to know you, that experience is helpful and people consider it extremely valuable. Whereas the 11 and a half minutes that you might get with your primary care physician, despite all of their education and despite all of their skills and their technical capability, a person leaves that experience feeling like they didn't get as much out of it. I'm wondering if augmenting students coming into medical school is going to allow for, on average, better bedside manner in the cohort of physicians. And I don't mean that disrespectfully, but I think all of us have experienced the brilliant clinician, the brilliant technician. That's the person. So when I was asleep, I don't care if the person doing the procedure on me is capable of having a conversation with another human being. I don't care. I want to know that they do what they do effectively. But do you think that these tools are going to change the nature of people who will go into medicine over time?
It definitely should. It will. And it's changing already. I'll say exactly from my own perspective when seeing patients. I'm not going to drop names, but I'll give you in general, we call ambient AI. There's a number of different tools that we have out there that I can go in there and basically be able to talk to my patient and look at them in the eyes and not have to deal with the computer. It's basically recording everything that I'm doing. And I can talk to the patient and really have that conversation that we long did not have. So we can train the resident, we can train the people now to kind of really do that and focus on the patient. And patients are liking it a lot because you don't have to be on the computer. And then I'm able to explain to them more what my plan is and seeing them. I don't have to go back to the computer and see exactly what is my plan for the patient. As I'm talking to them, I'm looking at them in the eyes and I can basically tell them this is exactly what it is. So this is what AI will not be able to replace. It's basically my co-pilot. It's my companion. It doesn't replace that trust element that I have to bring to the patient. It doesn't replace that context that I have to bring to the patient. It doesn't replace that sympathy when I see the patient. So it's gonna be, I think medical school will be taught differently. Resident will be learning differently. Uh, having it's just like having your car basically and know what to do with it. How much can you do with it? How much can you rely on it? So that will be the idea. But this is exactly this is how I think medical school it is. That's how we're gonna be able to use it. As you said, having someone holding your hand, that part, that component, you can't replace that with AI. So
No.
augmenting, yes, it is. And as I said, basically, it's a new way of learning. As you said, even going back to learning in medical school, not having your brain atrophy, you have to do both of them. It's just a higher level of cognition. You're using your cognitive facilities at a much higher level. You will be able to do that, and not have to really have all the clicks that you're doing in the computer to see your patient and things that are administrative that are basically not necessarily um, providing you with the best skill set that you could use at that point for the patient. So I think you have it as a mixed baggage. I mean, things that will not be replaced, as you said, the trust, someone coming to you and talking to you, someone, as you say exactly, in the emergency room that come, as your friend will say that, will come to you and they having their kid is sick. AI can't really translate that. It can really
Right.
help me with the information, but that part of it cannot be translated. And there's also the aspect of context, and that's also a new way of teaching medicine. We do take that into context what we're saying to the patient, but with AI even more, because if I don't really give the right context to AI, it will give me the wrong information. It could even be dangerous. So it's a new way of teaching, new way of learning. It's a different way. It is exciting from my perspective because there are things that we get to do that we don't have to worry about. That is, I'll give you a very simple example that we use AI a lot of times now for discharge summary or hospital costs. You could have a patient who's been in the hospital for 20, 30 days, and then you're coming in, you don't have time to read all those 30 pages. But if you get AI, and we have that at our disposal right now, if you get AI to do that for you, then you can function at a higher level of cognition where you could think much more about what's coming out of that. What did I get from that? Or the discharge summary that you'll have for your patient. So all of those are out there and they are very useful, to say the least.
So it's interesting because a lot of the discussion around AI expresses concerns about how humanity will fare in this equation. And it sounds like, at least in the kind of practitioner patient relationship uh, area, we have an opportunity to introduce more opportunity for empathy as we get that sort of note taking responsibility out of the way. And maybe a lot of the negative bedside manner um, criticisms have been levied a bit unfairly because you're thinking that your doctor it needs to be there and be present and listen, which they do. But you have to remember that they also have to meticulously pay attention and record everything that's happening. So on that front, that sounds like AI is going to enhance humanity. Now, in any sort of clinical setting, you have the people who are on the front lines with patients, and then of course you have administration. So, do you have any insights into what, say, hospital administrators are thinking when they think of AI? Um, I know that they have a resource allocation mandate, however you want to look at that. whether there are shareholders or it's a not-for-profit entity maximizing for service delivery. They are looking at efficiency being enhanced by AI. Are you seeing any conflicts in that space?
Yes, there is some conflict, but at the same time, also in the best places, you have the administrators working with the frontline workers to make it work. Uh, it start with working on some pain point for the practitioner, and I think administrators are recognizing that at the very least, if they can remove some of those pain points, as I said, um, charting and seeing patients and then having to go home and having to write those charts. I must tell you exactly with the new ambient AI, most physicians are very happy. And administrators are very on that. Although they might say that, you might need to see more patients. That's probably not being said that.
That's what I was, I'm sorry, I was waiting to jump in and ask you that because I can imagine a situation where you've just described this wonderful world of better patient interaction. And I, the administrator, say, that's great, Dr. Sanon. Now you can see 30% more patients in a day. And now we're back to where we were before.
Uh,
Um,
that's-
who pushes back on that? I mean, is that incumbent upon patients to demand more? Um, how does that feedback get up to the administrators who are ultimately sometimes making decisions about this?
well, there has to be some champions, I will say. There has to be some people that both sides can trust, that can bring that information back and forth, that can really close the loop in there. Because administrators will tell you that we're operating at a very close margin, and we have to push the boundaries. And AI is one of those where they could probably get some of it. Although I'll say exactly there's some hype to that because sometimes you invest and you expect some outcome from the investment in AI or the technology. It doesn't really come out that way. But yes, usually, hopefully, you will have some clinicians, some physicians or anyone in healthcare that is not an administrator or direct, who has some, I think that the patient care also, who can convey that. And that has to come from someone who's trusted on both sides by the administrators and also by the clinicians. So that's the balance that has to be made because yes, we're getting more out of AI in terms of the workflow. You're organizing the workflow better, scheduling is better. Um, You could even have, again, this is a very dangerous, like with the chat box, having the patient getting information directly from the chat box that's coming. So that's also dangerous. But again, like it kind of relieves some pain points for the physician, for the whole health system, and also help from what I learned from Wharton classes, the healthcare journey that the patient basically that they can navigate it better. So that also helps. That helps the administration, that helps the hospital or the healthcare system to attract more patients because they know that they can trust that. Trust is one that AI cannot replace. Context is one that AI cannot replace. And sympathy, empathy, AI cannot replace that.
Yeah. Okay. So now let's say we have a perfect synergistic relationship between administrators and frontline practitioners, and AI is helping that, and it's all wonderful. What about continuing education? Let's say no, in nephrology, so things related to kidneys. That's my layperson's understanding. Um, Although I have some experience, direct. Uh, but what about keeping up with um, developments in therapies that may be an outgrowth from using AI technology in biotech or pharma? As sort of a casual observer, I read stories constantly, as everyone else does, about things like the guy and his dog. If you're familiar with this story, I think he's in Australia. His dog had a tumor, pretty bad situation. He sequenced the DNA from the tumor. He sequenced the DNA from healthy blood, AlphaFold. which I know what it is, but I don't know what it exactly does. Um, Somehow they were able to then compare the two. Again, in my lay terms, I will say it's like, here's the healthy stuff, here's the unhealthy stuff. What's the difference? Okay, now how do we come up with a therapy that will address that? And in this case, it was an mRNA therapy, and they got the approval, and they injected the tumor, and the tumor reduced like by 50% within a short period of time. And now they're going back after the parts of the tumor that that did not respond well. And so we hear about these cutting edge things that could be years away from actually being part of a clinical setting that you're in today. Do you have to kind of ignore that background noise at this point, or is there sort of a mandate that you keep at least an ear open for these things as they're coming down the line? How does that affect your frontline engagements?
No, very important. I mean, you have to keep an open ear. You have to really be listening. You have to be out there and know exactly what's out there. I think I learned that from you, where you said, if you don't know about it, at least it's good enough that you know about it, and at least like you can do something about it. Like I think you analogy was basically having the land, the big land, and you giving me that land, and how do I really use that? If you have a tractor, that's one way. If you have to do it by yourself, that's a different. So the same, you have to be able to follow that and see it, because some of it at some point you have to, that's what AI is also helping from that um, pharmaceutical company, and it accelerates a number of things basically. So it's extremely important that we follow it. It may not be ready for frontline yet. It may not be ready for prime time, but you have to be ready. You have to be open minded. It's the same thing with AI. If I'll say exactly, a few years ago, most physicians were like, "No, I don't want to hear about it, nothing about it." But right now, many of them are basically have an open ear and then want to hear about it more. So the same thing with that experiment also. Some of them, I can say exactly, some of them, it will take a long time before they materialize. It's not really, there's a lot of hype. There could be a lot of hype going on from there. But I have to be ready, and we from the medical field have to be ready and be able, willing to embrace that new technology, and what AI can bring with that also, because there's a lot of potential basically from, as you mentioned, from the research perspective, from being able to accelerate a number of discoveries, medications, a number of, it's tremendous what we can get from it. It's just like at the same time we have to be able to separate the hype from what's real at that point. Might be a
Yeah,
lot of potential, but the potential that it is that we're seeing may not be there yet, but we
yeah.
we are looking for it.
Yeah, and speaking of AI, I just because in anticipation of our conversation, I think I'm clever. I put my notes together on what I think would be interesting to discuss, and I go to my chat assistant and say, "What else? What else should I? What else?" Should I? So, consulting my notes on things. What about, because you have a background that includes nutrition,
Yes,
and
I'm a licensed nutritionist.
yeah, yeah. And so on either that subject or any other, is there anything that you've seen recently that particularly gets you excited about either um, novel studies, therapies, um, tools that are coming out of the technology space that might improve our lives? Anything that gets you particularly excited?
There's so much excitement, in a sense that, and that's using AI and using all those technologies, being able to see exactly in terms of designing your meal plan. I'm talking about just from nutrition perspective. From nephrology, Mayo Clinic, there's someone over there, Wizzy, that I have to give it to him. He's really, really good at doing AI and nephrology. So we're using it a lot, even like for predicting exactly who is the patient is going to be really being overloaded, and how we use that. There's so much more that we can do. There was something, as I was talking to my friend, I have to tell you about that also. That was, I thought that was amazing. Let's say here we are, we're wearing our clothes, and we paying, and that's what we've been doing. But what if we get a lot of information from the clothes that we're wearing, from the watch? I mean, we already have the watch and how much you can get from it, from the tattoo that people are. So there's a lot that you can learn for personal growth of patients. So that will be much healthier, be it from the hospital perspective, exactly learning about the patient, what works, what would be the best therapy for that patient. Because I could have it coming from a number of different people, but again, if I can find the right treatment for that right patient. There's nothing better than that. So there's a lot that, from that perspective, there's something else I'm also being involved in is medication reconciliation. How can I use AI? Because a lot of times you have your patient coming in, you have the medications in. Is that the right medication? Is the list that you have, is that the right list? So being able to use that as well. Again, you will not be able to just use AI. You could use other technology like Internet of Things or blockchain and all those. You could use all of those, but AI is going to enhance that. So uh, everything should be, or at least like we hope that everything will be much better because you have more information. The more information that you have, if you use it correctly, you'll have better outcome for your patient. So it's very exciting from our perspective, at least from my perspective. It's exciting. The key is to be able to channel that information quite clearly in the right direction so that nobody is using it in the wrong way, and being able to recognize exactly the limitation of the technology also. Because just having it, I use, I'm going to say the name because I use it so much. Open Evidence, one of those that we use a lot. I think that really has enhanced patients' care. It's amazing to see exactly that I might have that technology that I have in there that I can search and research information that will be within context. But if you don't have the right context, so you'll be getting the wrong information. But if you know how to use it, it's you can't really have better tools than those.
Yeah.
So
Yeah, and it's interesting
it's
because, you know, probably the, more educated individuals are more guilty of doing the Google search and self-diagnosing and things like that. And of course, we all know about delusions that come along with large language models. Uh, my personal experience, and now having to be fair, I'm pretty good at prompting these models. I'd spend a lot of time
I
thinking
think
about,
that's key, Dave. That's what we
yeah,
have to know. You have to know how to prompt, because if you don't know how to prompt, you're getting the wrong information.
yeah, yeah. But I fed, and not to have this be the story of my kidney stones, Uh, but once I had my extensive lab results back after the actual material was analyzed and every blood and every fluid test they could come up with, I fed that information in along with information about my diet. And I had been paying very close attention to my diet because I had been trying to improve a lot of other metabolic numbers over time. And it was crazy. It asked me the question, do you, well, tell me again how many of these almonds you're eating regularly? And it absolutely and I'm like, "No, this has gotta be a hallucination." And the number one thing out of this, there were a lot of recommendations, but the number one thing was, "Yeah, you're eating way too many nuts, and because you've eliminated these other things in your diet, this combination of that and whatever else." And so when I actually had my consultation with my doctor, who was going to share those results, because I get the results immediately in my inbox. This is the crazy thing, right? And then a
That's
week later, I'm meeting with my doctor. I'd already gone through this, so I was armed at least with the right questions to ask. And there was a funny moment where my doctor, I had not shared any of this information with her. She asked me, she goes, "Do you eat a lot of nuts?" And I said, "Well, would you consider 2 or 3 heaping cereal bowls full of nuts each day a lot?" To which she replied, "You're joking, right?" And I said, "No, I'm not." And so the good news is, Dr. Sanon, uh, after a year later, after modifying my diet, I recently had ultrasound that shows no new stones coming. And I would consider that absolutely an indirect collaboration between the team at UC Davis. Thank you very much to all of them, and ChatGPT. Absolutely a collaboration. I've been able to put meal plans together and things like that. So speaking from the patient's perspective, and again, I can only speak to the University of California Davis Medical Group. I call them the Disney World of medicine. They're amazing, and so my experience has been there's been a lot of really really good collaboration, and I haven't met a doctor who has had the sort of real pushback like, "Ooh, that's scary. Be careful." It feels like we're all in this together, forging ahead, which is really interesting. But what would someone be surprised to hear about the intersection between medicine and AI from your vantage point? Or where do you think maybe the public narrative is getting things wrong? Do you have any thoughts about that?
A few of them. I was going to tell you a good story that I think I told you in private about a patient, but I'm gonna answer yours first. Uh, there's a lot basically that the misconception is that we're gonna have those doctors, or at least like the AI will replace doctors, will replace all of those healthcare professionals. It's gonna transform them. It's gonna also help the patient in a sense, but they have to know exactly the fact that getting your information. Also, you have to make sure that that's one of the things that we do in AI in a sense. I get everything, but I don't trust anything. I'm always questioning AI because if you don't question it, then you'll get the wrong information. But again, just like to say exactly, so at that point, it's great that the patient comes very informed with the information that you have already, and then that we can have a better discussion about it. So it takes it to a whole better level and a higher level. And the fact that they can really have that information about them specifically, assuming there's no hallucination when they put in those information in there that comes out of it. I think it makes for a great conversation. It kind of really enhance the treatment of the patient, and instead of you get much more information, and information that's what we deal with. That's our currency in medicine. The more information you have, the better it is, and that's why AI is helping a lot because you could basically from what you'll be having as silos coming from different sources, you could put them together and come up with what is the best approach for the patient. But I was gonna go back. That's a very good story that I think I told you. A lot of people have been hearing about it, and I heard it from when I was taking one of my courses about that patient who's not the patient actually, uh, a mother who had their son who was 4 years old, and at 4 years the kid was not doing so well. It was doing pretty well up to 4 years, and then started to deteriorate, and then over 3 years had to see 17 doctors and couldn't really find the right information. And some people were saying like the kid was being psychotic. There was something else really going on. So she's seen a number of different specialists. Ultimately, she decided to get that. I mean, she used ChatGPT and put all the information, all the data, everything in there in the chat box. And she said, what is wrong with my son?" And it did come out with the right diagnosis. Was able to take it to a neurosurgeon. Neurosurgeon said, "Yeah, it's tethered cord syndrome. This is what we're gonna be doing with it." But again, that's where the mom was empowered to do it. From the patient's perspective. I just wanted to see exactly where you were saying exactly where we could see the two of them coincide. At the same time, also there are a number of those big centers in the country where you have um, specialists. What they do is look at rare diseases, diseases that people nobody have an answer to them, and that's where AI also helps tremendously. And one of those experts was saying that he had a patient that was referred to him that he had no idea was a rash. He couldn't really figure exactly where that was coming from. And then ultimately, he fed that information. But again, as you said, prompting is the key. You have to know how to prompt the system. He fed the system the information. And sure enough, it came out with a diagnosis that he wasn't thinking about. And this is the rare disease expert. The expert who's in rare disease said, like, I wasn't expecting that. And it gave me a piece of information that I would not have had any other way. And then it did say exactly there was an association. I said, if patient who eat that kind of food, just going back to what just tend to have that disease. It's like, yeah, I did not really give that to the chat box, but it turns out that exactly that's what the patient is eating. So it's just to
Yeah.
show exactly that I mean, like not just the patient, but from the clinician also, it can help tremendously, even at the highest level of cognition, where the biggest expert, the most expert in the country are really looking at it. They're able to bridge that and come out of a lot for their patients. So it's augmenting our work, making it better, and I think humanity will come out better. I mean, we always gonna have other questions, basically, the ethical aspect of it, bias and all those things. You have to look at that also. Because like even when I get those tools, I have to make sure exactly that I know exactly where that tool was trained. What kind of patient did they use to train it? Because it's not gonna be the same with them as with some other patients. So you have to know exactly, is it appropriate for my patient? It's the same thing that I do when I read a paper on. You have to know exactly that information that I'm getting, is it applicable to my patient population? So these are other things that needs to be done. Bias, call it ethics, all of those have to be, even like doing papers, research papers, you could have much more coming out, but you have to look at that ethical aspect of it. So a lot of transformation, but I think it's all for the better.
So you mentioned something. You used the word silo, and silos are interesting in all sorts of realms, but in particular in the field of medicine, it's interesting because it turns out the more we think we understand the human body, the more we realize how miraculous it is and how much we don't understand. And traditionally, so like in your case, an incredible amount of time and discipline to gain a level of expertise dealing with certain systems in the body. And we have that expertise is sort of fragmented in a variety of fields. So, there's an old joke about a dentist is pulling a tooth and the tooth goes down the person's throat accidentally. And the dentist said, you're going to need to see an ear, nose, and throat specialist. The ear, nose, and throat specialist looks, it's further down in the digestive tract, says, you need a gastroenterologist. Eventually, he needs a proctologist. The proctologist sees the tooth and says, you need a dentist. And so the the silos of information, I'm wondering, how much are we going to be able to cross-pollinate and create kind of a holistic understanding of a patient with this technology where it was just not possible before? Um, is it, can you envision a situation where each of us walks around with a thumb drive that not just doesn't just have our entire decoded genome, but has all of the information about all of our body's systems that we can get information about, that then can be correlated in a way that just wasn't possible? Maybe the brain guy's not talking to the elbow guy, to use the technical terms for those specialists. And so, but there is, in fact, it turns out, wow, there is a brain elbow connection that we never knew about.
So
I mean,
it's
is it going to get better that way, do you think?
I think it's getting better already. Actually, I think just this year that they came out, there's one of those tools that they have where you have, I think it's more like for rare diseases. It's exactly that, where instead of silos, you get those information silos. So there's different aspect of that tool. There is the one of the tool who's basically kind of coordinate everything, but really send it to others. Like there's one that has to gather information from different places, different charts, different specialists. There's another one that has to look at the medical records. So I think it's there already. It's not really so futuristic. It's coming,
Okay.
and we a lot of us are already thinking about it that way as well. Um, the connection between different organs. Like one of the field that I'm very fast passionate about right now, and I kind of really I'm doing a free presentation on that is cardiovascular-kidney-metabolic syndrome. It's a new way of looking at patients in a sense that you go to the doctor, it's the nephrologist, they see you from one way, you go to the heart doctor, they see you one way, and then the endocrine see you one way. How do we connect all of them? And we kind of really looking at that connection and know exactly that, it's not one organ, it's a system that we have to look at. And if we treat the patient as a system, you treat the patient as a whole, as opposed to, okay, don't eat. I'm giving that lecture to the dietitians recently. I've been giving that lecture in the sense that, you know, don't eat that. And the first you say, don't eat the potassium, don't eat, and then the cardio said, don't eat salt. I mean, like lower your salt intake. And so patients getting different information. So if we could really get it and remove that silo, that definitely will help tremendously. So I think we're getting there. With AI, we can get there. We can really gather information from different sources and make sense of it, as opposed to like just from one specialty, one organ. Just remembering that the whole system is a system, and when it fails, it's not just one organ failing; it's a system failing. There's one that I basically get involved a lot in cardio-renal, had the heart talk to the kidney, and also had the heart and kidney and liver talk to each other. It's interesting. If you look at it, one base, it's a domino effect, and if you take it in silo, you're not going to get anywhere. But if you really put then they're gonna look at it from a system perspective, then you get better outcome.
And you believe that AI, using the broad term AI, can help us move in that direction dramatically.
There's no doubt about it. There's no doubt about it. I would say is that the AI is one of them. I'll say there's a number of different things, Internet of Things, and using like
Uh,
sensors. I think that's what you were saying earlier.
yeah, yeah, yeah.
Using sensors. I learned that from. It's a nice analogy that very was a chief of a big hospital, big health system left and got into the technology. I was watching him, and he said, like, it's interesting that we have cars, so our cars, before we get to the mechanic, we know exactly what's wrong with all those sensors. Why can't we know about that on us as well? And so that's where we kind of so if you get that information that is basically instead of really getting something in silo, you could really get the whole information about the car, just the human being. If we get that, then we'll be better in the sense that we'll know exactly before things happen. We could predict exactly where we're going from there.
Doctor,
So
that's called an onboard diagnostic system,
yeah,
OBD, in the car world. And the only problem is if you live in California, it's also something that's used to manage emissions. So there's a whole joke there, I'm sure, that can be made for if we put these OBD onboard diagnostic devices for humans. But so speaking as the officially designated representative of medicine, designated by me, as
that's
being that
that's a, that's a tall order. That's a tall
you have
order.
you are officially the spokesperson now. So you're saying that medicine believes that these technological advances are actually going to help improve our lives.
There is
Yeah,
no doubt about it.
yeah.
It's going to help to improve it, and it's just how we use it. But it's already improving it. It's already improving the workflow and hospital setting, communication with, I'm thinking about, like, in terms of digital technology in a sense, telehealth, that it's already improving in a number of different ways as opposed to waiting for 2 or 3 months, you could really get to see your doctor. I mean, there's telehealth that you could see the patient. There's so much more that you can do, and then AI can gather a lot of the information for you before you see the patient. There's a lot that is out there that we can do. Again, it's not all gloomy. It's not all like, oh, everything is just like so. There's no problem. There is definitely things that we need to solve, but it is moving us in the right direction, and that's what I like.
Well, fantastic. I would like to end this installment on that very cheery assessment, and then maybe Dr. Sanon, next time you and I get together, we'll talk about things like privacy concerns and the dark side of genetic engineering. But that's for another time. For for now, Julian, Dr. Sanon, I want to thank you so much for spending this time with us on Reality Check. Really interesting conversation from someone who is living this revolution on the front line, and on behalf of patients everywhere, all of the things we care about are meaningless when we don't have our health. And when you are in the hands of wonderful healthcare professionals like yourself, I know for myself, I am convinced that you are one of the angels descended from heaven for us. So, just want to appreciate you for what you do. And again, thanks for joining us here.
It's always, I say, it's always teamwork. That's what I tell my patient. That's what we like. We do it together. Um, we have the knowledge and we share the information with the patient. Now we have more information that we can share with the patient. Patient come with information for us also, and we basically, I think all of us who are in the profession, we love doing it. I haven't met anyone who's not 100% in their patient. I mean, like there must be, but I mean, everyone that I've known in the field in that profession, they love it, and there's nothing else that we'll do than that. That's where our heart is right there. So I will tell you, since you're really looking at that, I was telling you exactly how we a lot of people that are in the healthcare envision medicine. Imagine that you go to your doctor, your provider, and when you go there, the idea is that the AI, make it AI, digital technology, knows the provider, knows exactly their prescription, knows the patient also because they have that information in the computer, knows exactly where the patient is living. and being able to prescribe a medication or give that, you have that interface. The computer is your interface. AI is telling you exactly what, and you could basically coordinate the two of them with the computer, the provider, and the patient, and the environment, being able to design treatment for those patients. There's nothing better. That's futuristic to some extent, but it's not far from there.
Yeah, we'll get there. We'll get there. Well, for Reality Check, I'm Dave Nicholson. Thanks for joining us. We'll do our best every week to bring you increasingly interesting guests to talk about this subject. Thanks again. Hope to see you all soon.